Good morning, County Commissioners, County Managers, staff, and public. My name is Yoli Diaz, Care Patient Advocate. Cancer is the second cause of death in Doña Ana County. My ask is that you evaluate and consider the best option to assist our residents as updated in the August 22nd Indigent Healthcare Resolution. I'm providing you with a project proposal to consider. It is a joint project proposal between Doña Ana County and City of Las Cruces. Health insurance is the same solution I provided leadership in October 2021. I provide this viable solution to improve the crisis of access to needed health care to City of Las Cruces already. The viable solution I'm submitting is to assist on average 200 residents with health insurance. I mentioned to leadership the fund to use is not the indigent fund because of the 2014 fiasco of Senate Bill 228, namely the line items that the then governor vetoed. Therefore, my solution could be funded from the general fund or an unrestricted fund and legally through the New Mexico Constitution under the anti-donation clause because it does not prohibit the state, counties, and municipalities to make a provision for the care and maintenance of sick and indigent persons. Currently, the way the resolution is written and based on what I heard at the August 22nd BOCC meeting, Doña Ana County is prepared to spend up to $1 million to a cumulative cap of $50,000 per person per fiscal year and pay cancer treatment providers not to exceed Medicaid rate. Please correct me if I'm wrong on the $1 million. My solution is more fiscally feasible and fiscally responsible and fiscally prudent. If Doña Ana County can't do this on its own and needs to get state approval to amend the budget, it would be distinguishable as extremely more fiscally frugal and practical to help on average 200 residents than 20 residents, with the 20 residents potentially experiencing added barriers to finish needed cancer treatment. Please consider this viable solution. I will also provide you with Doña Ana County data from Charles Wiggins, PhD, Director and Principal Investigator of the New Mexico Tumor Registry that is pertinent to the project. The data shows almost 1,000 residents diagnosed with malignant cancer per year. Almost 23% uninsured at the time of diagnosis, and an average of 227 residents of the almost 1,000 uninsured per year. I am providing my concerns and vital patient-centered care to consider. I quantify. One, unfortunately, the simple math is that the updated indigent healthcare resolution, an average of 20 residents be helped, is actually 1 million divided by 50,000. That's 20. Two, if there's a cap on cancer treatment, what happens upon reaching the cap? It would be inhumane to tell a Doña Ana County resident, you have reached the cap, you cannot finish your treatment or have additional treatment for the rest of the year. This cap can create a barrier. It would be cruel to start treatment and not finish it. If you're writing contracts for cancer treatment providers, who are the providers you need to consider with a potential cancer diagnosis may include many different types of diagnostic tests, workup, oncologists, surgeons, hospitals, and much more. I'll provide a list, which my time expired, but I'll give you this list that gives you like so many that would be involved. So please consider it. I'll give you some data.
Thank you, Ms. Diaz.
Thank you.
Good morning.
Good morning, Mark Beath.